Hi, everyone. Welcome. We're having a lot of folks filter in from the waiting room, so we'll give everyone a moment to get situated. There is a link in the chat to view captions if you would like that. And on my end, I can just still see everybody popping in, so we'll give them a moment here. Sometimes Zoom is just a little bit slower than we would like it to be. All right, that's good. We'll go ahead and get started here. First, welcome. My name is Jessica Rogers. I'm the Coalition's Director for the Patients' Rights Action Fund, and I'm so pleased to be able to welcome you to this webinar focused on the disability justice perspective of assisted suicide. I'm so pleased that all of our panelists are available to give of their time and their expertise and to share that with all of you today. And I know that it will be a really interesting and informative webinar. We expect that it will last about an hour and a half. There will be time for Q&A. If you have any questions, please do put those into the Q&A box, and we will address those at the end. So I'll tell you briefly about Patients' Rights Action Fund. We are a nonpartisan, non-sectarian organization. We do nothing except work on the issue of assisted suicide. And we get to work with so many of these wonderful partners that are on the panel today, representing various organizations that are with us in this fight against assisted suicide. For myself personally, I'll share with you that I come to this issue from a very personal place. I was a caregiver for my mother who had a terminal illness, and we lived in Oregon at the time that she was diagnosed. So I've seen firsthand how this type of policy disrupts the relationship between a patient and their doctor, and how it impacts the overall family, and how it impacts people who are already so vulnerable getting that kind of a diagnosis. So with that, I will let you know that there will be additional resources shared at the end of this webinar for you, and they will also be emailed out to you after the webinar. So if you miss anything, that will be in your email afterwards. With that, I will introduce our moderator for the evening. We're so thrilled to have Blaise Bryant. He is the communications specialist with the New York Association on Independent Living. And outside of work, he hosts the Blaise Access podcast, which focuses on disability rights. And I'm very excited. I'm a new subscriber to his podcast, and I hope that you all will join me in that. With that, I'll turn it over to Blaise, and thank you.
Well, Jessica, if I need anyone to promote the podcast, I know who to turn to. That was a great promo for it. Thank you so much, and good evening, everyone. It's great to see all of you here, and thank you so much for carving out some time here on a Wednesday evening to learn more and take action opposing assisted suicide. We have a rock star panel of folks, and I'm going to quickly introduce them in alphabetical order. First, we're going to start with Alex Thompson, who is my coworker. He is the Director of Advocacy with the New York Association on Independent Living. Alex, thank you so much for being here. Really appreciate it.
Thanks, Blaise.
Of course. And now to Anita Cameron, who is the Director of Community Outreach for Not Dead Yet. Anita, thank you so much for being here and taking the time to be here. Okay. Anita, we can't hear you, but I know you're there. And then to Cliff Perez, who is the systems advocate with the Independent Living Center of the Hudson Valley. Cliff, thank you so much for being here.
Of course, Blaise. Thank you very much for having me.
All right, there you go.
Thank you for
And
having me, Blaise. This is Anita Cameron.
you're very welcome. There we go. And then next is Jose Hernandez, who is the president of the New York City chapter of United Spinal. Thank you so much, Jose.
A pleasure being here.
Thank you much. And to Julie Farrar, who is a mom with disabilities and is also a disability rights activist. Julie, thank you so much for being here.
It's an honor. I am happy to be here.
And last but certainly not least is Sharon Shapiro Lax, who is a board member with the Brooklyn Center for Independence of the Disabled. Sharon, thank you so much for being here.
Very good to be here, Blaise.
Thank you so much. Yes, of course. Cliff, if you could just move there. So let's start with this here. And the way this is going to work, everyone is going to share their story about assisted suicide and why it is so important. And what we're going to do is start with Anita, and I'm going to tee you up with this. You have been involved with Not Dead Yet, who is one of the leading disability rights organizations fighting assisted suicide since the beginning in 1996. Explain a little bit about who Not Dead Yet is and why the issue of assisted suicide is so personal to you.
So good evening, everyone. My name is Anita Cameron. I am Director of Community Outreach for Not Dead Yet. Not Dead Yet is a national grassroots disability organization that we are best known for our fight against assisted suicide. But we also work on, we fight against medical rationing. We fight against disparities in healthcare. As many know, the National Institute of Health designated people with disabilities as a group that experiences healthcare disparities. Not Dead Yet was started by Diane Coleman, rest in paradise, power, peace, Diane, who started Not Dead Yet in the wake of the Jack Kevorkian issue. He had been helping people to die by suicide, and we found out that many, supposedly these are people with disabilities, but we found out many of the folks that he helped to die were not terminal. And so Not Dead Yet was, so at the time, Diane Coleman was a member of and active with ADAPT, and that's where I met Diane Coleman. And Not Dead Yet was certainly a natural outgrowth, if you will, of ADAPT, that we were looking, into that. And so Not Dead Yet has become certainly one of the leading disability organizations fighting against assisted suicide. And there we go. And so my introduction into this was, as I said, I met Diane Coleman through ADAPT in a capacity of ADAPT. And so I was pretty much involved with Not Dead Yet from the beginning. what we were standing, you know, kind of what we were standing on business on, what we were working for, you know, and the and what we did. It was just something that was I was automatically drawn to that. How it got personal for me was in 2009. I got a rather frantic call from my mom's doctor, who told me that my mom's death was imminent. Told me that if I wanted to see my mom alive, that I had better get to Seattle, Washington in 2 days if I wanted to see my mom alive. And so obviously I did just that. I got to Washington State in 2 days and got to see my mom. She rallied. And she did not die, but she was still quite ill. And she was placed in hospice. It was said she was in the final stages of chronic obstructive pulmonary disease. That was a condition that my mom was born with. And so kind of made sense that she was in the final stages of this. When I got that frantic call, Washington State had just 6 weeks prior enacted their assisted suicide bill. So the bill had passed and it was now enacted. You know, it passed, it was signed by the governor, it was now enacted into law. And I was in a situation where, from 3,000 miles away, I am dealing with a doctor, a hospice doctor, who is doing everything short of actually suggesting to my mom that she take advantage of the new assisted suicide law. My mom always said that she was too ornery to die, but that was kind of wearing down on her. And so she survived hospice for 6 months, but the doctor still had her convinced that she was dying. Her body was in the process of dying. And so, with, the help, from New York and Colorado, and she went back to Colorado to die. She set up in her own apartment with the tenant services and nursing services, and basically my mom waited to die. Except that she had a few things on her bucket list that she wanted to do. And one of the things that she wanted to do was to get arrested with me in ADAPT on a national action. And so 6 weeks after she got home, that's what she found herself doing, getting arrested with me, fighting for disability rights and justice. And at that point, my mom decided that she was not dying and lived for 12 more years. And so, because of that, I mean, that hit home to me. I watched my mom's battle, if you will, this doctor. And so you know, it certainly showed me that doctors are often wrong. Assisted suicide is supposed to be for people who are terminal, 6 months or less, to live. They're supposed to request these, a doctor and another doctor, or a doctor and some other health professional signs off on this, and it depends between 15 days and 48 hours or whatever, you get this medication, and you ingest it. There's no witness or doctor required to be present, so there's no way that anybody knows of this. If you took the meds on your own, or if someone else took them.
About another minute, Anita.
Sure. Thank you. And so what I do, because this is so personal to me, and because of my experience with my mom, and my own personal experiences with disability discrimination and racial discrimination, that I experience in healthcare, because I have multiple disabilities, multiple chronic conditions, most are degenerative and will take my life. And so I focus on marginalized communities, and the fact that as assisted suicide is normalized across this country, um, people from marginalized communities will then begin to experience the weight of assisted suicide, especially as we live in states where access to services and healthcare is being limited, where we're looking at the attacks and situations on our disabled in this country. um, we have to be really careful, and fight really hard against assisted suicide in this country. Thank you so much. Um, I look forward to this. Thank you.
Absolutely. I mean, Anita, you shared so much, and it was wonderful, and really appreciate the story. In your view, what can people be doing to prevent assisted suicide and to continue defending against the other side who wants to make assisted suicide a reality?
That's okay. I'm gonna be real. As the young folks say, keep it a hundred, keep it a buck. Um, it's very difficult, the organizing and all of that, because the other side, the groups like Compassionate Choices, Depth with Dignity, these groups, they have very deep pockets, and not dead yet. We have very limited funds, and so it's important, I think, that we get very, very creative in our organizing, that we get loud, that we push back against those efforts, um, that we highlight, and that we debunk the major reasons that um, this pro assisted suicide camp are using, that we debunk them, that we show that it has to do with disability, that we also speak truth power, and um, call out the media for their blatant bias towards assisted suicide and their poor and disrespectful treatment of of the people who are against this, and of the disability community in particular. So there are lots and lots of ways that we can do this. We can do this from our homes, from the streets, with our pens, with our typewriters. There are many, many ways that we can do this and push back against this.
Thank you so much, Anita. This is fantastic. Now over to the Director of Advocacy for the New York Association on Independent Living, Alex Thompson. Now,
Thanks.
Niall has been leading the fight here in New York, more specifically opposing assisted suicide for about a decade. How have we been able to defend the very powerful compassionate choices from getting this legislation across the finish line?
Um, well, I think there are concerns, rightfully so. They have tried to amend the bill to, try to downplay our concerns, but it hasn't been successful, thankfully. I guess one thing that I will focus on specifically is that they have a line in the bill that says This is not to be used on disabled people, right? And that's supposed to satisfy all our concerns. Everything you're hearing today, all these concerns, are supposed to hang on that one sentence in the bill that says, "Oh, well, we're not going to use it on disabled people." Well, I will tell you tonight that in all the states where they pass this, they expand it. Number one. So, whatever limited version you're seeing right now is inevitably headed towards expansion, whether it's through the courts, like they did New Jersey immediately after they passed the bill, it ends up in the court. Um, or, there's some kind of lawsuit around equal protection where they say, well, you can't discriminate based on disability, so everyone should be able to use this. So, don't fall for that trick. It really is a trick. But I hear people saying, oh, well, we have this protection in the bill, so people with disabilities are not impacted. That is not the case. We will be impacted. It will be a direct impact on our population. As Anita said, we already carry a lot of weight, especially when it comes to healthcare and the medical system that so many people with disabilities rely on to stay alive and stay independent in the community. We constantly face cuts in New York, believe it or not. You would think that people with disabilities would not have a struggle like that, but I know people are very concerned with cuts federally in Medicaid, rightfully so. But I will tell you, in New York, we have been fighting against cuts. So this is a pervasive issue in the system that is not fully committed for people with disabilities to live independently without facing cuts and challenges. I wish that wasn't the case, but it is. And this is a fight we've been having since really the beginning of the independent living movement, where people with disabilities were forced to live in hospitals because there was no accessible housing and there was not care being provided in the community. So this is very much an independent living issue. It's something that, I know frequently people say, well, isn't independent living about choice? Like, isn't this just another choice? Well, I'll tell you, this is not a choice that exists in a vacuum. It's, there are systems that are pressuring people and that have impact on people's decisions. And, the way things are right now with, supports available to people with disabilities and how we are being made to struggle, it's really, I think it's unjust, to put it succinctly. I don't know if there are more questions, Blaise, but
Alex,
kind of
that was quite succinct. And you talked about the cuts that we're experiencing here in New York, which are constant, and it seems like regardless of who the governor is, that is the reality we're facing. Um, what do we say to the people who invariably will be put in positions of, okay, you have one of two options. You either go into a nursing home and die there, or seek out assisted suicide if this does become a reality.
Right. So I know we're going to mention it later when we get to resources, but there's a great documentary that just came out or is still previewing called Life After, and they talk about some of these issues regarding assisted suicide. So we'll share that later. But getting to your question, the life expectancy in nursing homes is like 2 years. And a lot of people think of nursing homes as being places for people that are, older, they need specialized care. There are a lot of people with disabilities that just end up in nursing homes because they can't find housing, or they don't have a support system in the community. Why can't they find a support system in the community? Well, the wages for aides are not sufficient. People are currently relying on programs that require their friends to be paid caregivers. It is a poverty level, subsistence situation that we put people with disabilities into. I am, you know, I I think that's a real pressure that we're putting on people on their lives to make it so miserable that they're considering suicide. I think what we've seen in Canada, where they're offering suicide instead of services. I mean, I think that's a pretty easy concept to understand when you have a for-profit health system that is saying suicide is the cheapest healthcare. I think I've seen Julie have with a sign, the Capitol, that says exactly that. And I think, it doesn't matter which side of the political spectrum you're on. I think this is an issue that, to see it from our view, you have to realize what the reality is in our healthcare system, and also the reality of being a person with a disability. It might be difficult for you to see that if you haven't lived it and you don't have the lived experience of having to deal with trying to get doctor's appointments, trying to find accessible housing, trying to find employment as being a person with a disability, managing the benefit system that frequently wants you to fill out paperwork and accuses you of being like a criminal or something, that you might be stealing from the system. And getting, disrupting your life when you get that letter from Social Security or social services that your whole life's going to be disrupted for the next few months, and your eligibility is in jeopardy. I mean, this is the reality of being a disabled person in America. And of course people are under such duress that assisted suicide is just it's going to be problematic when we give people that choice. Oh, well, do you want to kill yourself or do you want to struggle?
Absolutely. Thank you so much, Alex. Now we're going to move on to, kind of sticking with that theme of choice, to Sharon Shapiro Lax, board member with the Brooklyn Center for Independence of the Disabled and a former executive director of several independent living centers throughout New York City. Sharon, you've talked pretty extensively about the illusion of choice. Feel free to explain that.
Yes, I hope you don't mind, but I wrote mine out, so I'm sure to touch upon all the factors involved. So, okay, here I go. Okay, the power to make choices is essential to feeling in control of our lives. Choice is a core value of the independent living system. We want the ability to choose how we want to live, what we want for breakfast, who we want to befriend, and how we want to affect the people in the world around us. Once we choose what we want, we need the capacity and the resources to achieve our goals. People with disabilities have fought for many decades and continue to fight for the long denied respect, access, accommodations, and resources required to actualize the small and significant choices we make. Assisted suicide, or quote-unquote medical aid in dying, is often framed as a choice. People forget that the final decision makers are the healthcare providers and establishments. They determine whether or not the person is rational and mentally healthy. As someone with a disability, I contend with this all the time, that doctors and medical health professionals who are brainwashed who are tainted by centuries-old fears. They're the ones who determine who is rational and who has a good reason to die. Studies show that fears of loss of control of one's life and bodily functions, loss of quality of life and dignity, loss of independence, and the ability for self-care all rank higher than did the fear of worsening pain. It is generally erroneously assumed that once someone loses bodily functions, life is no longer worth living. People with disabilities live with that prejudice every day. We're frequently told, "You're amazing. I could never live like that." Couple societal prejudice against disability with financial incentives to help us die, we have a deadly mixture. Doctors and the medical industry need to work with the person to come to terms with the psychosocial implications of their condition, including having personal assistance at some point and exploring the way to enhance one's quality of life. At the same time, doctors need to prescribe pain medication according to the type, dosage, frequency, and duration that is required to alleviate pain and discomfort, even if the pain alleviation might result in death. The intent to alleviate pain is very different from the intent to end one's life to psychosocial maladaptive beliefs and fears. Real choice needs to be unfettered by psychosocial biases and financial concerns. Medical aid in dying is an illusion of choice. Thank you.
All right, we are, excuse me, working on the tech issue with folks not being able to see the ASL interpreters. So I appreciate your patience with that. And Sharon, you brought up a lot of really good points and appreciate the perspective. Just to give us a couple of minutes on why assisted suicide is so personal to you.
Oh, it's personal to me because I know that I was born at a time when disability, doctors were encouraged parents who had a child, had a baby with a disability to give it up, to let the baby die. Okay? And I know throughout my life how doctors and society perceive me and how my life in their eyes is not worth living. So I fear any legislation that helps doctors to basically kill off people who are becoming disabled, even though they claim that death is around the corner. I just see that as a very dangerous thing, knowing how I've been treated by an ableist society. So that's how it affects me.
Thank you so much, Sharon. We'll get to questions in about a half hour or so. But now we're going to move on to Jose Hernandez, the president of the New York City chapter of United Spinal Association. Jose, you have had some pretty recent experiences dealing with the media, more specifically CBS News, shortchanging you on assisted suicide coverage, and talk about that along with your own personal story with assisted suicide.
Yep. So, hello everyone. My name is Jose Hernandez. I recently did an interview with CBS that was supposed to be a two-part series, and it was supposed to be fair and impartial. And unfortunately, they were far from fair and impartial. The first part highlighted, the medical aid in dying, and the second part was supposed to be um, from the disability perspective, specifically my perspective and my experience. And half of my segment, or the segment that was supposed to be fair and impartial, was given to the assisted suicide proponent, and my segment only got a minute and 30 seconds. And it did not highlight anything of what I said. Like Anita, I have a similar story. My mother, when I was 8, was diagnosed with stage 4 ovarian cancer and was given 6 months to live. Again, I'm going to say that again. My mother, at the age of 28, she had 3 small children, was diagnosed with stage 4 ovarian cancer and given 6 months to live. With treatment, she lived 13 years. If assisted suicide was an option when she was diagnosed, I would have missed out on 13 years of good mornings, 13 years of good nights, 13 years of bumps and bruises where mom kissed my knees and elbows, 13 years of I love yous. And it shouldn't be that way. We don't have a guarantee. Medical science isn't a perfect science. And again, my mother was diagnosed with stage 4 ovarian cancer and given 6 months to live. I want you to hear that again. And she lived 13 years with treatment. If assisted suicide was an option, she would have discontinued treatment and she would have died. Also last year, my father, after battling leukemia, uh, had gotten a severe infection in his lungs, and the doctor said, "Hey, we can try to clear the infections in your lungs, and that would involve us going in there, putting you on a ventilator, but in the weakened state that your lungs are in, you will probably not come out of or come off of the ventilator." And my father made the decision, not us, he made the decision that he would go into hospice. And through hospice, they eased his pain. He didn't have to choose medical assisted suicide. He didn't have to have a doctor come in to the house, give him a medication, and we watch him die. We had a doctor come in, give him medication to ease his transition, and he didn't have to suffer. So the issue here is people don't want to suffer, but they don't want to choose uh, hospice as an option. You know, it's an underutilized resource. And as far as the pitfall for people with disabilities, I am a person who acquired my disability. I'm a spinal cord injury. I experienced a C5 spinal cord injury due to a diving accident at the age of 15. And it's a scary thing. You go from being able-bodied and walking around to your life being completely upended and you're no longer able to walk. You know, I'm no longer able to use my hands, and for a short period of time, I was severely disabled. I couldn't use my arms. You need assistance doing bowel, bladder care, getting in and out of wheelchairs, and you feel vulnerable and a burden to your family and the people around you. So we need to stop glorifying, assisted suicide, especially for those who experience disabilities. We have movies that, you know, the actors decide at the end life isn't worth living. And I can tell you my life is worth living. I have been injured almost 30 years this year. I have a 1-year-old son who I adore and look forward to seeing every single day. And I will fight for every last breath that I have, to make sure that I see him until I can't no more. And if the day comes that it's time for me to die, then I know that I have hospice. But people with disabilities do run the risk of doctors saying your life is not worth living. And it has happened. We have examples like Michael Hickson, Christopher Dunn, and there's others. It shouldn't be that way. Doctors shouldn't have the power to use their biases because they're not experts in all fields. Spinal cord injuries have specific doctors that, can tell us, hey, this is what to expect. And so do other uh, different disabilities. And as far as the media, like I said, they're not fair. Um, the CBS News article that went out seemed to go out intentionally in favor of assisted suicide in a time that Compassionate Choices is out in Albany really fighting to get this passed in New York, which is unfortunate because in New York, people with disabilities, like Alex said, are facing some serious cuts to home care. There's a lot of fear out there, and many of us are going to go without care and going to nursing homes if things don't change in the legislature this year. And that's sometimes a fate worse than death for many of us. So assisted suicide should be an option, and we need the media to stop glorifying it. And if you're a legislator and you're on this call, reach out to the people who are on the front lines because the media isn't going to tell you the truth.
Jose, I'm going to sound like a journalist with this question. Why, in your opinion, do we not value palliative care enough when we all know it does so much to comfort a person in their last days?
I have no idea because it's offered in facilities. It's offered in the comfort of your own home. You know, a doctor will come in and a doctor or a nurse or a team, a hospice team will come into your home and make you comfortable in your final hours or final days. Um, so there is no reason why you need to suffer or we need to legalize assisted suicide if there already is an option.
Well said. Now to Julie Farrar, who is a mom of 3 with disabilities. And I know, Julie, you have a couple of your children have disabilities. So as a parent, with all that in mind, you're an activist, you're a home care recipient as well. Talk about assisted suicide from these lenses, and you've got about 8 or so minutes, and I'll let you know when you're getting close to
Oh,
time in the chat.
You'll probably have to cut me off. But yes, my name is Julie Farrar, and I have 3 3 daughters, and just even having children was something where I was discriminated against before I even left the hospital. Before I even had my first child, there were people trying to take my baby away from me because they saw me as incapable of being a parent. With my middle child, I didn't have any problems at all. It's a long, complicated love story, but the father of all of all my children have the same father. However, he was there when Elizabeth, my middle child, was born. And there was not a question at all. It's just having him there and having him not be in a wheelchair. They had absolutely no questions about my competency. And then when my third daughter was born, um, I had a nurse she just kind of watched me. I had my baby in a boppy, which is like it's a pillow that a lot of people use with C-sections or to help hold. It's a great assistive parenting tool, put it that way. It's like a donut that goes around your middle and you can hold your baby in it and you can feed your baby in it. And a nurse was watching me, and I'll just never forget that. She was watching me and she said, how are you going to take care of that baby? And I said, well, I've got 2 more at home. I've got a 9-year-old and I haven't killed her yet. And the nurse actually said to me, oh, wait till they turn 16, then you're going to want to kill them. And we just kind of laughed. And, but she was standing in the doorway. And she called in social services and they were going to take my child away from me at birth. And I took a huge risk and I said, yes, I need help. And that is how I qualified for home care, was saying that I needed help in my home. And they could have just easily have said, you know what, we'll help you when we'll put all 3 of your children into foster care. And, it was the same when I was born. When I was born, I wouldn't live to be 2 years old. They should put me in an institution for if they ever had me. And I grew up being a fire and safety hazard. It was fun to be a fire and safety hazard yesterday down at the Capitol for a while. I tell this joke too much, but most recently during COVID, I found out by reading my own medical records that I won a t-shirt that says I survived COVID and all I got was this stupid hospital acquired infection. So during COVID, I had to go to the hospital every 6 to 8 weeks with sepsis. So I was dying. I was literally dying every 6 to 8 weeks from a hospital acquired infection. So I would go into the hospital and my friends, I know Denise, a friend Denise Denoto, other friends, they would sit there with me, sit there on the phone with me. I had friends that drove me to the emergency room because I didn't want to go. I didn't want to go. One situation that I was in at Albany Medical Center, just lay it all out there. I was there for 32 hours, I believe, in the emergency room. No food, no water, no, they probably checked my insurance, but no food, no water, no treatment, no hydration, no nothing. And I finally got called back into a room, and I was very scared by that time. And I was on the phone with my best friend, my sister Snow, and my parents. And a hospitalist came in, and I burst into tears. And she said, "What's going on?" And I said, "I'm afraid that I'm dying." And the very first thing that she did, without batting an eye, was try to get me to sign a DNR. And I don't know how to explain this to people, but during COVID, everybody who is disabled, we learned how society values us. It was a great lesson in how society values us. Those of us that had access to home care did much better than the people that were in institutions or were forced into institutions. But our home care workers, some of whom died of COVID, were our lifeline, our survival in the community. And this woman, she said, I said, "I'm afraid I'm dying." She wanted me to sign a DNR, and she said, "And very few people come back, and we most likely will break your ribs as we're trying to bring you back." And my parents and my friend who moved here from California to be my caregiver, which makes me so blessed, they shouted, "No, she's not signing a DNR." And so I was transferred to another hospital. But I fully believe from my experiences, including working with the veteran-directed care program, I lost over 50 veterans. They were all in the community, but if they had a DNR or if they got COVID, they may go to the hospital, but they lined the hallways with absolutely no treatment because they were so far down on the list of people who deserved to be saved. And I'm not sure how else to explain that, except that it is very much ableism. My daughters have been raised to be activists as well. They have been family caregivers. We've been a good team. And one of my daughters has pretty significant mental health challenges and also pretty severe fibromyalgia and PTSD. And she's quite vocal, and I thank her for being able to go through. Blaise had a program, Youth Power, that she went through to recognize her sense of disability pride and her sense of worth as a disabled person. And Anita and I have visited, I probably visited you with Anita. If you're a freshman, I'll probably visit you with Anita. But my daughter and I would be there at the same time that Compassion and Choices is going on. And my daughter would say, "Oh, please, Mom, I've wiped your ass twice today." That's what she'd say, because she's saying that's what these people are afraid of. These people are afraid of having someone assist them with activities of daily living because they're disabled. The ableism runs so deep that death before disability is very much a common theme in our society and a theme that we have to fight against in order to survive. And at the time, there was a woman, a young girl, 14-year-old, when we started doing this 8 years ago. Not that I haven't been working with Diane and Anita since, like, Anita and I know each other since the 80s in activism, but Diane and I also as well. But there was a girl named Jerica, and they did, and I can't remember her last name, and I apologize, but they did a GoFundMe for her, 14 years old, so that the community could throw her a prom so that she could die. She wanted to die. She was 14 years old and she wanted to die. And so what did the society do for her? They threw her a prom. And my daughter went through so much hell trying to get her pain under management, trying to get mental health services. And no one ever suggested that she should die. But now in Canada, mental illness and chronic depression and chronic conditions, they are using disability discrimination to open things up so that everybody can take advantage of medical aid in dying or physician-assisted suicide. Physician-assisted suicide, I believe, is homicide. Medical aid in dying is a physician writing a prescription for a patient to end their life. That's what it is. So stop with the semantics. It's ridiculous.
All right, well said, Julie. And I actually didn't have to cut you off, so I'm proud of you. Now over to our last panelist here, Cliff Perez, systems advocate with the Independent Living Center of the Hudson Valley. Cliff, you have talked so much about the corporate greed and the profiteering of assisted suicide. Those are, as long as I've known you talk about this issue, and that's close to a decade, those are two of the big arguments you've made. So flush those out for us.
And Cliff, you're muted.
Go off mute.
Is it muted on the computer, maybe?
Yep, still muted.
Okay, yeah, hit the thing. Oh, hang on. Let me come around to do this. It's all good. Let's see. There was a pop-up, and now
Oh.
you're good.
Am I good now?
You are. Yep.
Okay, everybody. My name is Clifton Perez, and as Blaise said, I'm the systems advocate at the Independent Living Center of the Hudson Valley. All right, so my issue with all of this, first and foremost, comes from the fact that I'm a devoted and passionate disability rights advocate for the past 40 years. And as such, I do all that I can to fight against injustice. My primary thing is to fight against injustice. There's just way too much injustice in this world, and people with disabilities encounter much of that. So there are three basic things that the premises that I use to sort of deal with and confront this issue. And those three are philosophical, historical, and analytical reasons. So I'll begin with philosophical. Philosophical reasons. Killing or the extinction of a conscious being's existence is wrong, period. It is wrong no matter how you look at it. If you were to do a survey around the globe, you will find that the majority of the human beings on this planet would consider that to be wrong. So that's philosophical. Historical. If you know anything about the way people with disabilities have been treated historically, you would understand the reason why those in power would want to get rid of people with disabilities. If you did any historical research into people with disabilities' existence within the past century, you will find out that there were these group of people called eugenicists. These people were comprised of doctors and people who call themselves progressives, and people to this day who call themselves progressives. These people wanted to eliminate 15 million people in this country to reduce the amount of undesirable people in this country. And the only reason they weren't carried out was because they couldn't do it in a way where it didn't alienate other people. So they then decided that they would then go the route of finding a way to sterilize people with disabilities against their will so they wouldn't give birth to any more undesirable people to bring into our society. As a result of that, there was a case in 1927 that went to the Supreme Court, which was a woman by the name of Carrie Buck. So it was Buck against Bell case. And in this decision, it was ruled 8-2 out of the Supreme Court judges, 8-1, ruled in favor of sterilizing people against their will. This gave the tool to those people who wanted to get rid of people with disabilities to do so legally. And as a result of that, between that time and around 1970, we, meaning this country, sterilize roughly anywhere from 60 to 70,000 people against their will so that they wouldn't bring any more people with disabilities into this country. That's historical, okay? Analytical. Analytical, we're talking about legislation that wants to codify into legislation, okay? So it wants to make part of the healthcare system two horrible things. One, as I said, philosophical, is killing human beings, extinguishing someone's existence, because that's what we're talking about, folks. We're extinguishing a conscious being's existence. So that's one. And the second thing that we do, analytical, that is wrong, is we then codify within healthcare legislation lying. Well, what am I talking about lying? Well, think about this. Think about when you have to write down, you have to make a record of what was the cause of death. Do you think that the legislation says put the truth? The truth would be that we killed them? You believe that they're going to put that down? No, that is not what they're going to put down. They're going to put down some aspect of that they died of natural causes, which is a lie. But yet we're going to institutionalize that and codify that into healthcare legislation. So there are only two reasons why you would have to have this within your legislation. One is because you inherently know that it is wrong to kill a human being. And so because you know that, you can't put that down. Second reason is the big reason why this exists at all. And that is to nullify insurance companies. Now, what you have to keep in mind is that we live in a corporate capitalist system. I don't know if all of you know exactly what that means, but in a nutshell, what it means is that corporations are the ones in charge. It's kind of like in the old Soviet Union, they had a state capitalist system. We called it communism, but it wasn't. It was a state capitalist system. It meant that the state controlled the capital. In this country, it is corporations that control that capital. And what do you think insurance companies are? They are one of those corporations. And in the final analysis, when it comes down to making any kind of a decision about whether you live or die, it is not going to be your decision, even though that's what they say, those folks who support assisted suicide. In the end, it will be the insurance company. The only time that you could have full 100% control over your existence is if you're the one paying for everything, but you're not. And therefore, since the insurance company is paying for it, they're going to have a really big say on whether or not they're going to continue paying for this. Now, remember, they're going to be codified into legislation. That means that they're going to have a say about what it is they're going to pay for or not pay for. Think about the problems that people have right now with genetic drugs, right? If a doctor wants someone to take another drug that is not generic, but if the doctor feels and is the kind of medication this person needs, if the insurance company decides that the generic drug is what they're going to pay for, I think you all know that that's what they're going to pay for. And yes, you might be able to fight this, and yes, you might be able to win. But think about when your existence is hanging on the line. You don't have all that much time, especially when they're going to probably be in a hurry to try and get rid of you. So that's part of the reason why I'm against this. And I said, and the other part of analytical is that you should never, ever pass legislation that is based on emotion, which is what this legislation is. It is based on emotion and not on analytical reasoning. The emotion is this whole business of people are suffering and we don't want to see them suffer and we want to help them. Well, if you don't want to see them suffer, then provide the services they need so they can live a dignified and a quality of life until that end comes. Remember that someone like Stephen Hawking, the great scientist, would never have lived, would never have done all that he did if assisted suicide was available and thrust upon him without his will or his permission, as was done, as I said, historically, against people with disabilities to sterilize them. Thank you.
Cliff, well done, well said. If you can, yeah, what the heck, just stay unmuted for now. All right, we're gonna do we're gonna get to questions here in the 24-ish minutes we have left here. And the first one I'm going to start with here, in no particular order, is with Alex. And this is mainly so I can get this up, and I didn't want my screen reader noise inadvertently coming across Cliff's mic. When you were talking, Alex, there was a question that came from a lady, Joan, that was asking about an assisted suicide case, or if there were specific assisted suicide cases that you could reference.
I'm not totally sure about the question. What type of?
There was a question when you were talking about now I'm trying to remember it, but just give us some cases, or unless Cliff covered it with the Buck versus Bell case on assisted suicide and the harms of it, or if you can't, maybe Anita, you could talk a little bit about the the Not Dead Yet lawsuit against the state of California. I just
Oh,
thought of that.
I think I understand the question. Yeah, there was a lawsuit in New Jersey right after they passed the bill. I don't remember the name, but basically advocates for assisted suicide in New Jersey, once it passed in that state, brought a lawsuit challenging some of the so-called protections in the bill that they passed. And that was like an immediate legal action that was brought against the state to expand the bill. And so, I know there are legislators in New York that support the New York bill, and part of the reason I think is because maybe they think there's protections there, but you should be aware if you do that they have no issue with suing the state or bringing some kind of legal action to expand it further. So, whether that includes amending the bill later or bringing legal action, that's something that, I think we worry about. So, but yeah, specifically New Jersey, but I think there are also other cases where they've gone back and amended the bill to expand it in other states.
Gotcha. And actually sticking with you, Alex, we got a question from Christopher Riddle, and I'm Christopher. If I miscontextualize your question, forgive me. I'm reading it out loud, or with my screen reader, and I'm just trying to summarize the best I can. And essentially, the point of Chris's question has to do with choices being made in a vacuum, and people with disabilities being coerced. And what would you have to say to that?
I think a few of us touched on that. Many of us touched on that, I think. So I could start that off, and then whoever else wants to add. But yeah, I think it's just the systems in play. I mean, this is something we talk about a lot in independent living, is basically being, how we're impacted by different systems, whether it's healthcare, housing, employment, the state federal benefit systems. So it's very difficult for people to make a choice. And Cliff was touching on that just earlier. So I think that's kind of what what we're talking about when we say these choices are, the choice to end your life, which is a very serious choice, like Cliff said. You're extinguishing a life. There's not an undue situation. That's a very serious thing, and yeah, I don't think it's a choice we can view as being without influence, a lot of other factors.
Okay, great. We just, like I said, we're ticking down to about 20 minutes here. We've got a few questions here. Anita, I'm going to throw this one to you. So the question here for you is about like physicians carrying out assisted suicide, and I had the question right here. Jessica, it was another question from Joan, and did I find it?
I have
did.
it here. Oh, you got it. Okay.
Yeah. If you can, actually, Jessica, if you could just help me with the Q&A, and then I'll cut people off as I need to.
Absolutely. So the question is, are the physicians encouraging assisted suicide as a means literally to the end? And if so, how exactly do they assist? So if someone wants to speak to the practicalities of maybe what assisted suicide is and how it occurs.
So this, Anita, often in there was a 2021 Harvard study that shows basically doctors have a bias against the lives of people with disabilities. And because of those biases, they look at our quality of life as something lesser or lower than someone who is non disabled. Um, add to that racial disparities in healthcare, along with disability disparities in healthcare. And because of that, um, so you need a terminal diagnosis, right? So doctors are more likely to write you off as terminal. Say, there's nothing more we can do. Um, there are doctors who will, and I have several dear friends who, when they acquire their disability, doctors are trying to convince them to go out easy. My dear friend Terry Lincoln, who was in a car accident at the age of 19, the doctors approached her and her mother, trying to convince them to let them remove her from her ventilator. They would give her drugs to make this process easier, and she could die. um, Terry and her mother resisted that. And Terry lived almost 20 years and wound up having a beautiful daughter and whatnot. So when the doctors devalue your life, and whether they do this consciously or subconsciously, it's still done based on what they learn in medical school, based on what society teaches you about disability. And so you then have these doctors um, who will very subtly see, when people think of coercion, they think of like basically someone kind of like browbeating you or really, really harassing you and whatnot. There are very subtle forms of coercion that are done to people with disabilities every day in a medical setting. And then like I said, you add to that, you layer upon that, and this is where you get. And there are some states where doctors are prescribing this medication to people who are not terminal, to people whose conditions are not terminal. For example, people with anorexia nervosa, that is not a terminal condition, and yet there are people dying by assisted suicide because doctors prescribe them that.
I,
For
I want,
sure.
yeah, I wanted to mention something very quickly, and that is in California, when they first thought that the legislation was going to pass, Kaiser Permanente sent a memo out to all doctors reminding them to advise that they had a duty to advise their patients about physician assisted suicide upon diagnoses. They rescinded that memo, but it was sent out to everybody in an anticipatory manner.
And this is Cliff from Perez again, and as I had said earlier, historically, it was the medical profession who were very much behind the sterilization against people with disabilities. From the point of view of the medical profession, people with disabilities are not good from their perspective because they can't fix us. And within the medical profession, their whole thing is about fixing something that's broken, and we apparently are permanently broken, and as such undesirable beings on this planet, and as such we need to get rid of them. And that's a huge reason why assisted suicide is not very good at all for people with disabilities. Not to mention that we don't live in a civilized society. If we lived in a civilized society, first and foremost, you wouldn't need civil rights laws, right? Which tell people that you should treat a group of people with kindness. Why would you need legislation to tell people how to treat other people with kindness if you were a civilized species? And if we were a civilized species, this issue of assisted suicide wouldn't be an issue, because we would know that we would do everything that we could to help that person have a quality of life. And we would know that after we have done everything that we could and nothing was really left to do, that we would do everything that we can to help them move to transition from this existence to the next. But we're far from that.
The thing
This
that
this is Sharon. I want to do two things. First of all, when we talk about people with disabilities, we're not only talking about people who are already disabled. I want to make this very clear, because once you become ill with cancer or with another terminal disease, quote unquote, you become a person with a disability. So just remember that it's not that you're just ill, you become a person with a disability and you become subject to the same prejudices that people who are already disabled have been subject to for most of their lives. So I just wanted to bring that up. When I talk about choice, I am not negating choice by saying that legislation like this is not a good idea. What I'm saying is, as Cliff pointed out, the value of our lives is not a value that's held by society. So, in effect, we end up having no choice because of how the biases are just laid out in front of us. And that's what we have to fight for. We have to fight for the services. We have to educate people that needing help does not mean that you're losing dignity. Okay? As long as we don't do that, then we really don't have choice.
Well, yep, well said, Sharon. I'm just gonna jump in here because we're about 10 minutes of time, and we've got the resource slide to share as well. So we've got time for one, possibly two more questions, and I have because I'm having some slight screen reader navigability issues with the Q&A right now. Jessica is gonna 30 seconds, Cliff. Go ahead.
If I make just quickly, I just want to really reiterate, or maybe not reiterate because it wasn't mentioned, but to make very clear that there are certain characteristics or eligibility criteria that would put somebody in the area of having assisted suicide upon them. I just want to make it very clear that millions of people with disabilities fit that definition. They fit that eligibility. They meet those criteria, and therefore they are eligible to be eliminated from this reality.
Cliff, thank you so much. And I think that leads directly into one of the questions that was asked, which is, Are there examples of when a disability may become a terminal condition without proper health care? And as you've all expressed so wonderfully, and I wish it wasn't a reality to express, there is a challenge in accessing proper health care when you have disabilities. So could you speak to how not only are reasons of disability why people in states where this is legal are opting for assisted suicide, not for reasons of pain, but for reasons of disability? Can you provide a couple examples of what might become a eligible condition under this law?
This is Anita. One of the conditions that I have is a condition that millions of Americans have. I have diabetes. And if you, right now for me, my diabetes is a chronic condition. If I lose access to my medications, whether it's my insulin, whether it's my metformin or whatnot, if I lose access to those medications, my condition, which is chronic, then becomes terminal, and I am eligible to request assisted suicide. And in my case, almost a year ago this month, in fact, a year ago this month, um, I had a life-changing health issue that wound me in the hospital and in a nursing home. And after I got home from the nursing home, I applied to receive home and community-based services and was denied by the state of New York. When you don't have access to the services and supports that you need to remain independent, to remain healthy, to remain in the community, if you are living in a state where assisted suicide is legal, it then, it puts you over to, and there are lots of other conditions, like diabetes that, yes, if you lose access to your medications, if you lose access to treatment, and that condition becomes terminal, and that's hidden in the assisted suicide laws. And what you have to know is all the assisted suicide laws in this country are based on the Oregon law. And hidden in the Oregon law is where if you lose access to, or not even that, if you decide to stop treatment, your condition becomes terminal, you're eligible for assisted suicide. That is deeply hidden in the laws, and the assisted suicide proponents do not want to hear you say that, do not want to hear you talk about that. They're always confronting me when I say it, but it's hidden in that. And so I'm really happy that that's being talked about, because that's an example of a situation that could make you eligible.
All right,
Anita,
great.
thank you so much for
Yeah,
that.
I want to, we have not heard from Jose, so I want to give you a chance to weigh in on this, Jose, especially given your story, about both of your parents and their cancer diagnoses.
I, I don't know. There's just too many pitfalls and things that can go wrong in the deciding to take one's life, and it's just so final. There is no take back, like Alex said, and we should value all life. We have all of these new numbers for suicide hotlines, and we have posters and says, if you're feeling suicidal, call this number, we can help. But if you're disabled or sick, call Compassionate Choices and they'll help you die. And it shouldn't be that way. We should value life. We should value every breath that we have.
That's the perfect way to wrap this up before we go to the resource slide, which Jessica is is going to put up here. I know we have some outstanding questions that we didn't get to, and apologies for that. Jessica, there is a way to pull the Q&A report, and we could talk offline if you need help grabbing that. And we could send the questions out to send the questions out to panelists and answer whatever questions you have. So I apologize. We didn't get to everything, but now is as good of a time as any to share the resource slide and tell us what's on it.
Absolutely. Oh, there we go. Hopefully everybody has access to see that. So here's a few websites for you to check out for more information. The first, going to make a plug for my group, patientsrightsaction.org. On that website, you can learn all about this issue. There were a couple questions in the Q&A that seemed like maybe you were looking for a little more practical information about what is assisted suicide and the nuts and bolts of the legislation. We're happy to serve as a resource for that. Anita's organization, notdeadyet.org, another wonderful resource to check out for you. And all of these resources will be emailed out as well. We wanted to note DREDF. They have just a tremendous wealth of resources about the consistent work of the disability community on this issue. Cliff is here representing the Independent Living Center of the Hudson Valley, ilchv.org. Blaise and Alex represent NILE, the New York Association on Independent Living, nyail.org.
No, actually, I'm going to correct you on that. It is actually IL. I know it's confusing. And
I'm
yeah,
so sorry.
it
I
is.
thought I
No,
double checked it.
it is all good. It is ILNY for Independent Living New York.org. Jessica, back to you.
Thank you. My apologies, Blaise. I don't know. None of this would have happened without Blaise walking me through the technical aspects of how to run a webinar. And then bcid.org, the Brooklyn Center for the Independence or for Independence of the Disabled, which is the organization Sharon is here representing. And then we want to point your attention to ncd.gov, the National Council on Disability. They have a tremendous report on the dangers of assisted suicide and hold a position of opposition. There are also two films briefly I'd like to mention. One is brand new. I just premiered at Sundance. It won an award. I had the opportunity to screen it. It was really excellent. And it features both Alex and Julie. And that's Life After from the very talented director, Reed Davenport. I will send out a link in your follow-up emails to all participants on how to access that film. And then if you haven't seen it yet, please watch Better Off Dead, ? From actress Liz Carr. That one, I don't have a direct link for, but it should be on YouTube and it is worth watching. And finally, my email is jessica@praf, PRAF, for patientsrightsactionfund.org. You should all have my email if you had the flyer to sign up for this. If you have any questions about how to get involved, you want to understand what's happening in your state on this issue, please connect with me and I will get you plugged in. And there are a few states that we really desperately need all hands on deck to make sure, as Jose talked about, we don't really get a fair shake from the media a lot of times. And we rely on the people who can go in and talk to their legislators and submit those letters to the editor and set the record straight about the public's opinion about this dangerous legislation.
Thank you. Thank you so much, Jessica. And that is all the time we have. So thank you to our rockstar panel of Anita Cameron, Alex Thompson, Jose Hernandez, Julie Farrar, Cliff Perez, and Sharon Shapiro Lax for such a great conversation. And to you as attendees, thank you so much for your great questions and commentary And of course, to Jessica, who was the glue that made all of this happen. And of course, to our interpreter and captioner for making this a fully accessible webinar. We will send everything out. And we have a lot of work to do on this issue. It's quite clear. So process the info tonight and get to work tomorrow. Thank you all very much.
Thank you.
You have a good night.